So we have a lot of different modalities that we can use in the office to help with pain. There are three of which that I focus on when it comes to whiplash. So obviously there's a lot of muscle tension and there's a lot of inflammation going on in the muscles around the spine when there's a whiplash incident. We also may have some disc involvement, so we're going to talk about a couple different techniques that we can use. So the first one that we use is our cervical decompression table, and this is basically mechanical traction that's going to pull and then relax. And what this does is it has a couple of rubber bumpers that go right at the base of the skull, and then this straps in your head, and then this pulls the headpiece up and then slides down, pulls it up and slides down. So whenever there's any kind of disc bulge or disc rupture from a whiplash accident or an auto accident, this is a really good piece to use. It's pretty comfortable. It usually doesn't cause any pain. It usually feels like a good stretch, but we also have a button to hit in case it does cause any problems. So that's what we would use if there's any kind of disc irritation. With a whiplash accident, there's a lot of damage to the soft tissues that surround the spine. So with the muscles, we're going to be dealing with a lot of muscle tension. So what we want to do is use our electrical stim, which is similar to a TENS unit if you've ever used one of those. And what this is, we put 4 pads around the area that is a problem, and these pads conduct some electrical current into the muscles, and what it does is it helps to break up the muscles and also relieve some pain. So it really just feels like a tingle, feels like a nice gentle massage, but it's working on the muscles themselves to help break up some of that muscle tension and reduce some of that pain. So while you're on it, we usually do this for about 10 to 15 minutes, and then while you're on there, we put the ice on. Now, ice is one thing I do want to talk about. It's something you absolutely should be doing at home to decrease the inflammation that is caused from the whiplash. Most people don't have symptoms right away. They usually tend to set in over the next 24 to 72 hours. So you want to make sure that you're icing immediately to help fight that inflammation process as much as possible. So make sure you're doing 10 minutes on, 10 minutes off, and put a damp rag in between the ice and your skin just so that it penetrates a little bit deeper. So the other thing that we're going to be doing while Pat is lying here is we're going to be talking about our laser. And our laser is a deep tissue laser, which actually works with light. So ultrasound is what we used to use to help to decrease inflammation in whiplash accidents. And ultrasound works by heating up the tissue. And that's how it stimulates the healing process. With a deep tissue laser, it actually uses light to get down to the cellular level and stimulate healing that way. And so it's a lot more effective than the ultrasound, works a lot faster, and has more penetration. So what we would be doing is working all along the muscles, along the cervical spine, and then down into the traps as well. And we're going to be doing both sides of the neck. And normally with the neck, it takes about anywhere from 5 to 7 minutes. So it's not a real long therapy, but it works really well. So those are the different things that we can do in our physical therapy department to try to help decrease some of the symptoms, some of the inflammation, and some of the muscle tension. So the third thing that we really focus on in the office with whiplash accidents is the muscles along the spine. So we're dealing with muscle tension and also muscle weakness. So the first one is the muscle tension. That's probably the most immediate problem because what we talked about earlier in the video, the muscle tightness is what's causing that ramrod spine. In case you didn't see the earlier part of the video, A, I suggest you to go check it out, but B, what ramrod spine is where the curve of the neck, which is normally like this, straightens out. And the reason it straightens out is because those muscles become so tense along the spine. If we can get those muscles to relax, the curve is allowed to come back into the spine. Now that curve is so important because it spreads the weight out throughout the cervical spine. If it's straight up and down, you tend to get a lot of pressure on the base of where the spine is straightened out, which is usually at the base of your cervical spine or of your neck. And that's when people 10, 15, 20 years down the road start to feel problems and start to have chronic issues because their discs have started to degenerate because we never got that curve back into their neck. So after the whiplash accident, it's really important to make sure, it's a reason why you need to be getting checked out to see what can be done to help with that. So in our office, what we do about the muscle tension is we put you with our massage therapist. The doctors work hand in hand with the massage therapist, who are really skilled dealing with a lot of auto accident cases, dealing with whiplash treatment, and they can help those muscles start to relax. It allows the adjustment to be more effective, as well as allow that curve to start to come back into the spine. The second part that we really focus on is the muscle weakness. Now, we have a 2,000 square foot functional fitness facility in our office, and a personal trainer, Nancy, who again is well trained on how to deal with auto accidents and how to deal with whiplash injuries. And again, the doctors work hand in hand with Nancy as well as the massage therapist. So she actually shot a video this week talking about some different stretches that can be done. So we're making sure early on in the whiplash treatment that we're doing range of motion exercises. That's number one. We've got to get the range of motion back into the spine. Movement is life, and that is true in your spine especially. So making sure that everything's moving the way it's supposed to, and then once we start to get that range of motion back, starting to add in some strengthening exercises to strengthen any muscles that might have gotten weak in the meantime. Now, there are some ligaments that tend to get stretched out in whiplash, so we want to make sure that those are, the inflammation process that we were talking about earlier. We want to make sure that we're decreasing that inflammation as much as possible. But by strengthening those muscles, if we do have any ligament laxity, the muscle strengthening is going to be really important to make sure that there's not too much motion going on in your spine in the long term. So if you have any questions, or if you want to find out more about whiplash or how we treat it in the office, make sure you head over to wellnessspringfield.com and or give us a call at the office. It's 726-0422. Thanks a lot.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.